Do no harm. It's part of the Hippocratic Oath, but for years there's been a risk of harm that many patients may not have even considered possible. The New York Times reports hospitals, doctors, and doctors in training sometimes conducted pelvic exams on women who were under anesthesia, even when those exams were not medically necessary and when the patient had not authorized them. It's the kind of thing you'd like to have a heads up about, and the Departments of Health and Human Services announced a new rule to make sure patients get one. Hospitals must now receive informed patient consent for breast, pelvic, prostate, and rectal exams, particularly on anesthetized patients. For more on the policy's implications, we're joined by Mello. She's a professor of law and health policy at Stanford University. Thank you, Professor, for joining us. How widespread was this, were these kinds of non-consensual exams?
Well, there aren't any prevalence estimates, but this has been a practice for a very long time. It first came to light in the 60s in the medical literature, and over the decades, it's been a subject of some distress for many medical students and professors. And
the reason it was done, I can guess, but why was it done? Why were these?
Yeah, to be clear, this new policy is about conducting these exams for training purposes. So letting medical students and other trainees get more practice doing these exams on patients under anesthesia, the thinking goes, increases the number of opportunities for practice, and also does it on patients who are not going to be hurt or harmed as much as an awake patient would be.
And so was there a precipitating event that caused the federal government to step in, or was it just the accumulation of people saying there ought to be a law?
I think every time the media picks up a story of a patient complaint about this, it, for very good reason, causes a lot of public consternation, and this time that reached legislators. It's also possible, although I don't have any specific information, that a lawsuit may have been filed. I say that only because the letter to hospitals informing them of the new policy came from the HHS Office of Civil Rights, which is the agency tasked with enforcing the nation's healthcare anti-discrimination laws.
And would there ever be an emergency situation in which this could become an issue?
No, it's important for people to understand that this is not about having to give consent in order to get one of these exams that is necessary for your own medical care. This is about situations where it's being done in connection with another procedure and is not part of the necessary operative or preoperative care for that procedure.
Mello, professor of law and health policy at Stanford University. Thank you so much.